Assalamu alaikum. Hello, dear friends. This is one of a series of videos about hospital policies and procedures, which are written instructions on how staff members do different processes. Policies are general rules that govern our performance, and procedures are sequential steps on how we do it, and the responsible person for each step. We can update these rules when we have new standards to follow. In this video, we will talk about the policy of care of the dying patients. For more videos, please visit my Facebook page, Healthcare Quality, and my YouTube channel, Dr. Hassan Kamel. If you like it, please support me with likes and follow. This policy is applied to all hospital medical, nursing, and allied services that can be provided to the dying patients at their end of life. Statement of purpose. 1. To ensure that terminally ill patients will be treated with dignity and respect. 2. To ensure appropriate care of those in pain or dying at their end of life. 3. To guide the management of pain and primary or secondary symptoms in dying patients. 4. To prevent symptoms and complications as much as possible in dying patients. 5. To address patients and family psychological, emotional, and spiritual needs regarding dying and grieving. 6. Staff is made aware of patients' unique needs at the end of life. 7. To address patient and family religious and cultural concerns. 8. To involve the patient and the family in care decisions. And 9. To provide support for the patient and family during the dying process. Definition. Dying patient is terminally ill patient with irreversible pathology approaching end of life with short medically expected lifespan. Policy statement. Number 1. Assessment and reassessment of dying patients and their families should be individualized to meet patients' and families' needs and should include physical assessment, psychological assessment, social assessment, spiritual assessment, life closure and death preparation, circumstances of death, pain management, symptom relief, cultural aspects on illness and death, family support and care, functional limitations, current medications, physical limitations, patients and families' perspective on present illness, family emotions and coping mechanisms. Number 2, end-of-life care provided by the hospital address dying patients' needs. Number 3, Care of the dying patient optimizes his or her comfort and dignity. Number 4, interventions are taken to manage pain and primary or secondary symptoms. Number 5, symptoms and complications are prevented to the extent reasonably possible. Number 6, interventions address patient and family psychological, emotional, and spiritual needs regarding dying and grieving. Number 7, interventions address patient and family religious and cultural concerns. Number 8, the patient and family are involved in care decisions. Number 9, the quality of the end-of-life care is evaluated by family and staff. And number 10, a qualified nurse should attend the dying patient. Procedures. 1. Thorough assessment of the patient medically, psychologically, and socially by multidisciplinary team. 2. The multidisciplinary care team is composed of the treating physician, qualified nurse, social worker, and dietitian. 3. Effective preventive and therapeutic care plan 2. Assess the dying patient as frequently as necessary to identify symptoms. Assess and appropriately manage pain and primary or secondary symptoms in dying patients. Prevent symptoms and complications as much as possible in the terminally ill patient. Involve the patient and family in all aspects of care, especially care decisions regarding the dying patient. Treat the terminally ill patient with dignity and respect. Provide appropriate treatment for any symptoms according to wishes of the patient and his family. 4. Address patient and family psychological, emotional, spiritual, and cultural concerns and needs regarding dying and grieving, then respond to them accordingly. Respect patient and family religious and cultural beliefs, values, and preferences. Provide support for the patient and family during the dying process. Understand that the family go through anticipatory grief before the actual event of dying. Understand that different family members will react differently to impending death and support the different reactions. Be aware that demonstrating your concerns and caring will assist the family to cope with the grief process. Identify your own feelings about death and the dying process, then share your feelings with your colleagues to safeguard your own feelings of loss and sadness that arise during the care of dying patient, so the negativity doesn't transfer to the patient or the family. Explain to the patient and family their right to evaluate the quality of the end-of-life care provided and their right to complain if needed. 5. Decrease the patient's discomfort as much as possible. Provide warmth. Provide assistance in moving and position frequently. Provide assistance in bathing and personal hygiene. Administer appropriate medications before pain becomes severe. 6. Observe for the symptoms of urgency and/or emergency conditions. Inform the charge senior staff if there is an impending crisis or ask for immediate help. 7. Provide emotional nursing care for the patient. Assess the patient condition, level of consciousness, and the level of functioning. Assess psychological condition of the patient without making judgments. Establish a relationship with the dying patient willing to be involved. Encourage the patient to do as much as possible for himself so that the patient doesn't just give up. Provide time to spend with the patient so that not only physical care is administered. Make sure that your physical presence is comforting to the patient by just staying near to him if he is frightened. Use nonverbal communication as touch if appropriate. Identify the grief patient and support him. Respect patient's needs for privacy and withdraw if he needs to be alone. Determine whether the patient wants to talk and express feelings, cry, or even discuss the dying process. 8. Sensitively address such issues as autopsy and organ donation if applicable. 9. Educate patients and staff about managing symptoms. Responsibilities. Treating physician. Lead the multidisciplinary care team. Put the medical care plan to manage pain and other symptoms as much as possible. Design the care plan to prevent complications as much as possible. Discuss with the patient and the family alternatives in medical care plan and involve them in decision making. Attending nurse, psychological and nutritional screening before referral to social worker and dietitian. Care of personal, physical, and hygiene needs of the dying patient, for example, bathing and warmth. Decrease the patient's discomfort as much as possible, for example, positioning. Observe for the symptoms of urgency and/or emergency conditions. And provide emotional nursing care for the patient. Social worker. Psychological assessment of the patient and his family. Address patient and family psychological, emotional, and spiritual needs regarding dying and grieving. Provide support for the patient and the family during the dying process. Dietitian. Nutritional assessment of the dying patient. Nutritional care plan according to the patient's condition. Dealing effectively with the special nutritional needs and problems of the dying patient, such as loss of appetite, poor oral intake, loss of weight, swallowing or chewing problems, or enteral tube feeding. And here is a sample of the assessment of dying patient checklist. Approval of each policy is usually done by the preparing person, recommended by the department head, reviewed by the nursing supervisor, and approved by the quality director, medical director, and hospital director. Thank you.